Good afternoon, everyone. My name is Wei Ming. I'm the lecturer from School of Pharmacy. Welcome for joining us this afternoon. And I will be the moderator for this afternoon. So as you know, due to the pandemic, there are so many changes for the teaching and learning activities. And the topic for today we are going to explore is adapting the next normal at IMU. Now, before we begin, I have few housekeeping rules to announce. First, we have muted the microphone for all attendees. Second, for questions and feedback, please use the Q&A panel. We will try to answer your questions as much as possible. In case there's any specific inquiries that we will need further clarification from the admission office, we will then connect you to the person in charge. And lastly, the live webinar will be recorded. Okay. Now, we used to do all the classes, the practical face-to-face in the campus. We have the chance to meet our colleagues, our friends, but due to the pandemic, the things totally changed. I'm sure that all of us missing the old good time, visiting the campus, spending the good time with our friends, having a good meal at the canteen. We hope that we can return back to the normal as soon as possible. But for the time being, we are still trying our best to overcome the challenges. And for the university, we are taking all kinds of strategies to try to improve the teaching and learning activities to make sure that the quality is still maintaining at its very best. So today, I'm sure you have many questions to clarify how we conduct online classes, how we guide the students, how we help the students when they face certain difficulties. And today online with me, we have Dr. Wong Pei Si. She is the Associate Dean, Teaching and Learning for IMU. So hi, Dr. Wong.
Hi, good afternoon, everyone. Thank you, everyone, for joining us today.
Yes, thank you for your time. So maybe before we enter to the topic, can you share a bit more about yourself?
Yeah, sure. So good afternoon, everyone. I'm Dr. Wong Pei Si. Okay, just like to start a little bit about, give you a little bit of introduction about myself. All right. As you can see from the slide, I'm a graduate of, I had my first degree around in 1996. And I joined the program, basically the IMU, basically that time it's called IMC and Strathclyde program. So I did my undergraduate with IMU back then, which is a twinning program. Following my degree, I joined a master program. I also had a PhD, and after I joined the pharmacy program, basically I joined academic at the same time. And before joining academic or universities, I have a little bit experience in retail pharmacy and also hospital. Basically, I think as you can see from the journey I have, my longest journey is basically in the university. So this year is my 20th year with IMU in education at the same time as a lecturer. Journey basically don't stop there. In my journey in IMU, basically I did my PhD and I so recently did another master's. And I think I look forward to just share with all of you a little bit more about how we have been teaching and how we've been teaching and how students have been learning during this pandemic time.
Wow, that's really wonderful. 20 years of experience. Right, so today we are going to talk about the new normal at IMU. I'm sure the university is working very hard to try to deliver our best. Perhaps, Dr. Wong, can you share with us what is the current strategies that we are implementing to help the students?
Yeah, definitely. I think for the benefit of all the students, I will be highlighting few things into this very short slide or short presentation before we move into Q&A. Okay, I mean, I have to highlight that this is just a summary of what we are doing, but I'll be highlighting some of the changes in the teaching learning and support during the COVID-19 period, which is actually more or less 1.5 years now, since it started in March 2020. And of course, highlighting to you what are the things that are successful factors that actually was helping us actually throughout this journey of adaptation, and how we see things are moving into it. I think as what Dr. Lim Wei Ming has highlighted, the COVID-19 hit us in Malaysia sometime around March 2020, and it was in speed. No one predicted it, and everyone caught by surprise, and not a lot of people has predicted and prepared for it. And the largest or the biggest changes in education basically is to move not just solely online, but it's remote basically, which means that people are learning from a distance, far away. And we thought might be temporarily, but the temporarily has ongoing basis affected us for the past 1.5 years. So we are not saying that we are moving completely remotely in future, which we hope not, because a lot of health professional education might not work very well if we are solely on remote, and we understand it, we acknowledge that. But unfortunately, various movement controls still put us into a lot of heavy dependence on a lot online and technology, which is unavoidable. But just to highlight one thing, online remote technologies in education are not completely new. There has been existing distant learning, remote learning for many, many years. It's just that it's not common in undergraduate pharmacy courses, not common in a lot of undergraduate courses. So, and before highlighting some of the changes or somehow online teaching learning has been moving or going on in the School of Pharmacy or in pharmacy program, just to give you a little bit of idea about online or technology use, I'm sure some of you would have known what is high bandwidth. We have technology which is higher bandwidth. This is example what you are doing right now, Zoom, video conferencing. You require a relatively higher bandwidth to get stable and to interact with people. Okay, and you have also technology which is lower bandwidth, and these are example WhatsApp. You don't need such a high, or sometimes you use your phone to download some copies of PDF. You probably don't need such a high bandwidth to usually do these type of things. And we have what we call lower immediacy technologies as well. This is example of basically technologies which doesn't require interaction immediately or in person during that time. Example, WhatsApp. You leave a message there, people interact as they are convenient. But of course, you have higher immediacy type of technology where you are demanding the people to interact with you, like video conferencing, group chatting in WhatsApp. People, when put into the group, there are certain expectations, people are interacting with each other. So that's the higher immediacy that we are looking at. So in School of Pharmacy or in pharmacy program, I believe we didn't struggle too much in terms of movement into online or remote during when pandemic hit us. I think the benefit that we had during that time in the March when pandemic hit us is that we already have some existing pre-recorded video narrated slide. So these are some of the types of online teaching, or what we call e-learning, that has been always in the School of Pharmacy. So we already have existed that even before the pandemic. So we were using quite a lot of the teaching learning tools like pre-recorded videos, narrated slide during the pandemic started time. And of course, at the same time, we have always been using e-learning portal to support a lot of our teaching and learning. Students can find practically a lot of reading materials on the portal. There are discussion platforms like forum where students can discuss on their own. There are assignment submission things and textbook reading where is placed onto the portal for them. And of course, we've been using a lot of email in communication. So these are the types of IT or online things that's always been existing even before pandemic, where our school or even pharmacy student has been using. Okay, and of course, I have to admit there were major improvement. There's a lot of improvement into these areas, even though they have been long used. Partly, the student needed something a little bit more simple to use because they are relying on a lot of online resources now to learn. So they really need a lot of easy to use resources. So we had a major revamping on trying to make things easier and also make sure the accessibility is actually convenient for students, which means students can actually find it easily and able to use it and understand on their own when they actually read it. Of course, the other thing that we see some changes where mostly actually are more of student motivated themselves is the group chat messaging and collaborative documents. In the past, before pandemic, people or students, when they do group work, you will realize that they usually meet in the campus, they discuss together, that's what they have been doing. But of course, during pandemic time, especially movement control order, many of them are actually shifting into studying from their own home, They're not able to actually meet each other face-to-face. So they move a lot into group chat messaging. Some of them actually use a lot of collaborative document sharing. Actually, in fact, I learned a lot from my students on how they have actually shared document and various tools that they are using to share a lot of documents. So that's been used quite a lot. The other thing that we are also using a lot now is the video conferencing and also audio conferencing, just like what we are doing. Okay, because in the past, there's a lot of face-to-face teaching, like what we mean physical teaching, where teachers are giving the lectures to the students in a lecture hall, but of course, or even workshop. But of course, because of the pandemic, because of the lockdown, there are difficulty in doing all that. So a lot of that would have been moved into video conferencing. We are using Microsoft Teams. And of course, we have proctored remote examination as well when the university are closed. Okay, and that's some of the mode that we've been using. As mentioned, I think we use a lot of video and audio conferencing now for example, Microsoft Teams for lectures, not just lectures, but small group teaching, like example, workshops, tutorials, mentor discussion session. Okay, if students require any support, they will consult the lecturers through Teams. They can email the lecturers or they can WhatsApp the lecturers. And of course, the students are using a lot of different communication skills, as I say. And other than some of the changes that we have made on the quality of the videos, lectures, and teaching lectures, there's a lot of areas where we are improving in terms of the procedural skills, demonstration as well. Okay, students are having difficulty may not necessarily be able to get all the demonstration face-to-face now, so they get some of it actually through videos. That doesn't mean that the lecturers are no longer responsible for doing the teaching. Bearing in mind all this video require a lot of input of the lecturers to design it in the first place to make the students understand, make it easy for them to understand. At the same time, personally, I felt the communication between the students and also the teachers around this pandemic time in fact has been actually more often. In the past, students usually come to me during their lecture time, which means that after my lecture, if they don't understand, they will come to me and they will ask me face-to-face during that hour. But now that because everybody is at their own home and they are studying at their own pace, at their own timing, they may text me, they may WhatsApp me, they may email the lecturers whenever they don't understand things. So the communication has been going on using different modes and different support system for different types of students, suiting whatever way that they wanted. Overall, the change of learning, of course, will require a lot of organization of the timetable, partly because the students are a lot more online now. So we need to make sure also the students are not overwhelmed with too much of online materials and teaching at the same time. Okay, I acknowledge, and of course we acknowledge, not every learning in a pharmacy course can be replaced or best learned and taught online. For example, practical skills or laboratory skills, or even some of the physical skills where we think that is important. And these are usually skills that what we say that the touch and feel are important, which means that you to touch the thing, example, devices or equipment to learn. It requires you to feel the environment, see the patient to be able to actually learn the best. So we admit this type of learning may not be compensated or may not be completely replaced with the online teaching. Hence, a lot of laboratory skills remain as campus, but because the campus are closed and because of the movement control order, and there is also, of course, safety measures, usually these sort of laboratory skills are actually delivered at the universities based on the timing. You know, some of these laboratory skills or practical has been shifted to timing where it's allowed. And of course, all measures has been taken if the students are to return to universities to do this sort of practical skills. So we still run some practical session. And in fact, Dr. Lim is one of the teachers who do a lot of practical session with students, you know, even on weekend. And that's more because of the timing and arrangement with students, where students find it more convenient if they are to deliver in block and including weekends. So a lot of negotiation has to happen to when we reschedule some of this teaching into face-to-face. The other areas where I think a lot of concern raised was the visit and placement. You know, a lot of visit and placement, for example, community pharmacy, hospital, and industrial, what I meant pharmaceutical company. And it was very challenging for a lot of universities. And in fact, many pharmacies universities have shifted all completely to virtual. In IMU, we were a bit blessed. Our final year students managed to secure community pharmacy placement because we had a lot of partners and they were very willing to accommodate our final year students. So most of our students has undergone 2 weeks placement in community pharmacy despite the pandemic challenge in January down to around April timing. So, but it has to happen in a very small group and in a very arranging manner because things change from time to time. So I have to compliment our students, you know, willingness as well to accommodate the time, and of course understood the responsibility, partly because it does pose a risk to the students who go into the placement as well. And of course, being health 4th year students and being that they will need to be able to sustain and work in this type of environment, I'm very, very happy to say that at least our students are quite happy to go and they take all measures to protect themselves and make sure that they are able to learn the best they can during that timing. And placement at that timing certainly, I mean, as I know, speaking to some students was a very it was a very interesting thing because things that you're seeing are probably completely different from whatever that you normally see in a community pharmacy. But unfortunately, a hospital placement, pharmaceutical company placement was not possible for us, at least during this year. But in future, we were still hoping to provide students with opportunity and visit and placement wherever possible. But of course, when I said that, this really relies on a lot of factors and which is not controlled totally by us. Okay. The other thing about is in terms of the teaching content itself, you know, of course, there's a lot of demand in a lot of technology-driven digital health, what we call, you know, and IMU has launched a master in health informatics and analytics recently as well. And of course, this course is not designed during this time. You know, it takes about 2-3 years for a course to be launched. So it has always been preparation and since few years to put a lot of content relating to digital health into the curriculum. And of course, we have managed to update our curriculum as well this year and finalize it to make sure that there is digital health component inside the pharmacy program for undergraduate students who are coming in, so that to prepare them to cope better with the practice of digital enhancement in future in healthcare. And lastly, university students, I don't think the stress are completely because of what they study, like the content itself. There are many non-academic matters, example, personal relationship, family relationship, financial, and we have a lot of issues with loneliness, boredom, you know, being bored at home due to all this isolation. And because of that, I think universities has done a lot of work into trying to maintain student welfare as well. That includes some fund where eligible students may apply if they fit into it. There are also 24/7 counselors to support. And of course, all students in IMU, including all our former students, are appointed with one mentor. So all students will have a mentor to speak to if they wish to, and the mentor will guide them accordingly. Yeah, if the students come to us. You know, as mentioned, you know, hospital and pharmaceutical, for our cases is that hospital and the pharmaceutical companies in the placement has been was not possible, you know, basically due to the challenge at the institution side to offer. They were not they were not ready to take the students, and the student obviously need to graduate on time. So there's no way we could accommodate. But having said so, what we have done is that we have arranged a lot of webinars, online classes, and even small groups learning for our students so that they can interact with some of the hospital pharmacy. So what I'm saying is that if our student could not go into the hospitals, we would want to, what we have offered is that we have bring the hospital pharmacists to our students. So basically through the online portal as well. So because that's the safest way for students as well as the pharmacists themselves. So, and many students find this actually at least fulfilling, at least be able to discuss the cases, be able to see different perspectives and understand how the hospital pharmacists are actually working and what are their expectations and what are the things that they need to deal with whenever they are working. So that has added a bit of values into the placement. So we are not saying that entirely replacing the whole placement, but again, it's sufficient enough to address majority of the learning outcome as we expected. Yeah, so that's some of the things that we have done. I mean, pandemic time basically posed a lot of challenge with placement, and a lot of people, are having difficulty. But yet, even our year 3 students who have also successfully secured a placement actually in private hospital as well. I will later leave you the link in the chat box if you are interested to read a little bit about experience from two of our year 3 students who actually went for a placement during the pandemic time this year. I think the future and the future, or what we call the next normal, I don't think people can 100% guarantee what's happening. There are still a little bit of uncertainties. But what personally I felt that there would be still some component existing, example, self-directed learning. There would be also demand on the technology part. So, but nevertheless, from my experience, I'm confident that we will, or in fact, our School of Pharmacy will be able to provide still the quality education to our students, and possibly partly because of the experience that we have. And some of these are reasons why I said so. And firstly, because we know education works best when students are faculty are open to new experience, and just like what happened over the 1.5 years. I think it's an experience not just for students and also for the teachers themselves. And the good part is that all faculties and teachers are willing to work together, and students are open to the new experience. And in fact, after 1.5 years, I talked to many students, and many of them are actually enjoying and starting to adapt to it. And they are learning new skills in managing and controlling their learning. And that's actually, in a way, is a better form. Yeah. And the other thing is the transition adaptation require a lot of communication. So this is what we've been doing as well. As part of the quality assurance, we always talk to our students. We always get feedback from students, feedback and also suggestion. And any form of feedback, suggestion, if it's reasonable and benefit of teaching for the teaching learning, we will surely explore and improve. And that's always been shown to by the universities or by the school, whether or not the pandemic actually happened. The other thing is that we have very close communication with regulatory bodies such as Pharmacy Board, MQA, which is the Malaysian qualification agency that actually provide the accreditation for the universities and the program. And many innovation changes in pharmacy education are supported by all these regulatory bodies. And to me, it's very important, and it's important that I highlight that this is assurance of complying to educational standard. And, and that is what all universities, and include us, are trying to make sure all the time. In fact, our program, pharmacy program, had our last accreditation this year. Our last accreditation is this year. The report was positive, although there is still some adjustment to make, and we were complimented partly because of the support we gave to students during pandemic. As pharmacy educators, I think myself, and of course many of my colleagues as well, admittedly, we are not expert in technology, we are not expert in online and things like that. But nevertheless, I think we have been trained well to a certain extent to do the best we can in things like that. And the other thing is that we do have a very, very supportive e-learning team that support how to enhance teaching in using technologies. At the same time, we were trained ongoing basis, on how to use this technology to enhance our teaching. So at the same time, the other good thing about it is that the student actually gets support from the IT team, especially on software use and things like that when it's launched to the students. So that's what we actually provide as well. And of course, as mentioned, we work very closely with partners and industries, and these are the partners and industries who have actually accepted our students in various placement and visit, or actually work with us in education. In fact, we had our first virtual stakeholder meeting last month, which is coordinated by Dr. Lim. And we managed to invite some of them to come in to give input to our students, about our students, at the same time to give us some comment on what are the things that we should be actually making sure to improve so that we can cope with the whole education changes, not only education changes, but the healthcare changes in it. And I'm happy to share that there were partners who were very, very happy with the quality of our iNew graduate. But of course, again, there's always room for improvement. And with that valuable feedback, I'm sure we will be able to improve how we prepare our students better. I believe in critical timing like this. I think it's not just solely about universities and teachers. And to me, it requires a lot of working with students and various industries. And that's how we manage to adapt and transition smoothly to make sure that education are given the best we can. Yeah, I think that's all from me. I think hopefully this sharing at least give you some idea or paint you some pictures on how teaching learning has been adapted. And I believe this is an ongoing basis things, because we cannot predict what's going on. So things might change from time to time. Yeah. Thank you.
Thank you, Dr. Wong, for the presentation. So we can see, at least we know that our students, they are still adapting very well with the online learning activities. It's always good to hear that. And we still have a bit time, and we do have quite a number of questions popping up. And okay, just let me highlight a few questions from the Q&A panel. Okay, there are two questions that are very similar, so I will combine both of these together. So for the attendees, they are asking about the placement. So how are we going to conduct the hospital placement during this pandemic? And then during the placement, not only in hospital, but also in the community pharmacy and the industry, will they get paid during the placement? So what's your input, Dr. Wong?
Yeah, I think there are two questions to this. The first thing is about how it's conducted. Ideally, we would like the students to still join the placement, but of course, the ability to be able to secure a placement rely on many factors. I can't tell for future, but of course, if future allowable, we would like to still go on with placement. Okay, and if it doesn't allow, then a lot of changes will have to move as accordingly into virtual, just like what we have done to the hospitals. Yeah, but of course, for this year, what we have managed to maintain is the community pharmacy placement. All right, after a lot of negotiation with the community pharmacy, but of course, hospital was challenging because we know the ongoing cases going up. The pharmacists are just not, and hospital are just not ready to take any students. Pharmaceutical industry are having a lot of stress as well because of the new demand on medication and things like that. So they were not ready also to take up a lot of students. So that answer the first question. The second question is that the students don't normally get paid for placement. These placements are part of the educational placement, which means that it's a mandatory as part of the course. So if it's not able to be done physically, then the universities has the plan or have to make arrangement to make sure that the student learn more or less the same, even though they don't go for the placement. And like I said, it's not easy to equate, but we try to match as many learning outcomes as we can.
Yes, I guess now the community pharmacy, hospital pharmacy, even the industry, they are very packed at the moment. So yeah, for safety reason, I think we will do what we can do best for the time being. And when the situation gets better, then we will look for the alternative. All right, so yeah, there's another question coming up regarding the learning activity. So are we going to have async lecture or synchronized lecture in a pharmacy degree during this pandemic?
We have actually both. As I said, we have combination. We are using combination. So like pre-recorded lectures, narrated lectures, what we call recorded online session. These are all available in the portal, and they existed as asynchronized. Even reading materials are asynchronized, which means that you work on your own. You can go in and look at it at any timing. We have synchronized, which is face-to-face, just like what we are doing right now. That happened in the curriculum as well. So we are using both, basically.
Yeah, we are having a mixture because some students, they will prefer to study at their own pace using an asynchronized session, but certain learning activity will require your lecturer to be at a synchronized session with you to clarify your doubt at that point, right?
Yeah. Can I just add one more point is that even though students have a choice, but in the program itself, there is a minimum demand that the student will have to attend certain numbers of synchronized lecture and also workshops. Or not synchronous lecture, but synchronized small group learning session. At a certain point is the mandatory, partly because we are trying to make sure the students we are not leaving the students on their own. We have to be able to sometimes meet the student and interact with them so that they grasp their learning better. Yeah, so some of these are really mandatory where the students will need to attend, where at the same time is the opportunity where the students and the lecturers would interact and apply whatever knowledge that they have learned. Yeah, thank you.
Okay, great. There are a few general questions. I think just a short answer. So someone is asking about the number of intake per year. We have 2 intakes for pharmacy that will be on July as well as September. And another question is regarding when are we going back to face-to-face classes? Wow. From what I know, we are slowly open up face by face, right, Dr. Wong?
Depending, I think the answer really greatly depends on the few factors. Basically, the first one is the government policy, when they allow. Second thing for university consideration is the safety. Even though if universities allowing it, whether it possesses risk for the students or not, if we will have to be basically making sure both of this being addressed when we want to move face-to-face classes. What I would say that we will be moving face-to-face classes very much when the universities are able to open first for practicals and skill-based. Yeah, that's the priority at the moment. The knowledge-based so-called like lecture where you just listen or things where you can done effectively online may still stay online for a little while. Yeah, so the priority for face-to-face is really the practical laboratory skill. Am I right, Dr. Lim? Yeah, yes. And also skill session basically. And that one, we really, really hope we can move back physical as soon as we can. Yeah. Again, like I said, it has to be the safety has to be considered.
Yeah, the student safety as well as the colleagues' safety will be always our priority. We want to make sure everyone is good and healthy. Okay, now we have a few more questions, and these are more related to employment and then the differences in the program. Now, talking about the employment. Now, there's one attendee asking about the current situation. They are saying that the pharmacist is getting a bit saturated. So yeah, maybe I can just start by giving you a little bit of facts. We do look at the ratio for the Malaysian population to the pharmacists in Malaysia. At the moment, I remember we are still below the recommended ratio for the WHO recommendation. And I will say that the saturation is basically very much depend on location as well. For example, more people will be preferred to work in KL, and then there will be less people in the rural area. Depend on your preference as well. So yeah, Dr. Wong, what about your input?
The question is asking about saturation. What exactly is the questions about?
Yeah, the students are worried that when they complete the pharmacy program, it will be very competitive. The government is not taking in pharmacists for practice anymore. Yeah.
Definitely. I think it's a logical concern, definitely. Yeah, but just to highlight itself is that, how should I put it, that there is no physical data or ideal data that we're looking at when we say about saturation. part of the reason is because when you graduate, you are able to work in private industry, and that cover community pharmacy, private medical centers, pharmaceutical companies, not just hospital. So the private part is actually always expanding. No one knows what's their demand like. Actually, to be very honest, we can't even gauge what's the demand, because the private can grow as far as it can go. Hence, I think the saturation sometimes is very difficult to gauge, partly because if you are intending in future, your training will want to be in hospital as well, definitely will be very competitive. But I have to be very honest, I still have pharmacy who are writing to me and asking for whether I have graduate or students who would like to work with them after graduation from private sector. We were still getting this advertisement once in a while. So I mean, definitely like what Dr. Lim is saying, I think the job opportunity after graduation, which is for you to do your training, they are jobs. It's just that whether the area is what you want. It's competitive in some areas, definitely.
Yeah, in the Q&A, I see there's a question. Maybe one student, he or she like clinical pharmacy very much. He planned to become a clinical pharmacist, but he or she is worried that he may not able to enter into the government sector to practice as a clinical pharmacist. And then the another question coming out is about, is it only 2 years contract in a government hospital? Well, I would say at the moment, yeah, it's only 2 years, but we will not know how the policy will change in a few years later. And I will also suggest that you may also consider there are many new areas coming up, right? We know we have students working in digital health. I think this is a very big sector, right? Digital health, looking at how data analysis, in improving all the health managing system. Yeah, so don't restrict your mindset only in the clinical practice, but you can also always explore into many different areas. Okay, then we have a few questions about our IMU program. If I enroll for the local program, is there any chances for me to get exposure to do part of the program overseas?
I think yes. Part of the program would be, part of the component will be on the research. Yeah, there are basically two common sort of situation where our students, the local track students, are actually went overseas. The first one is when they are doing elective. Yeah, so just like example, one of my mentors actually are interested, I mean, not now, obviously, previous few years, were very interested to go to Taiwan to be attached to one of the pharmacy or institution or hospital. So what they did is that they wrote to the Taiwan universities to do their elective there, and she managed to go there to do it as well. So that's the elective timing. But I just want to caution that actually these are very much student-owned initiative, and they would like, because they choose what they wanted to do. So they find the location that they want, and they would like to go into overseas. Okay, the second opportunity in the curriculum where students would be able to go into the overseas basically is through research. We have a lot of research. We have semester 7 dedicated for research. And in this research, some of these research are collaboration research. Example, let's say Dr. Lim might collaborate with someone from UK, Spain, or other places. And they are willing to take the students to go to their universities if the students sign up for the project. So we will indicate certain project where the student, if you are doing that project, you will need to be going into the overseas partners to actually do the project. Yeah, so if students who are interested to really travel or make a bit of exposures to overseas, then they can actually sign up or sign up for this type of research project where then they would be able to transfer or go to that particular place, that universities for a short period of time. Normally it's about 4 to 6 weeks, if I remember. Am I right, Dr. Lim?
Yeah, correct.
Yeah, about a 4 to 6 week period, and then they come back for their remaining assignment. These are all student paid. They have to fund their own, basically. Yeah.
Okay, great. And there's another student asking, right, whether he or she should immediately pursue master after completed the degree immediately. Yeah, I think this will very much depend on your personal interest and your planning as well. So I think you need to consider whether the financial status, Do you have any scholarship, or are you willing to pay for the tuition fee? And what's your plan actually, right? For master program, we do have master program in IMU, master in pharmacy practice, master in pharmaceutical analytical chemistry. We do have molecular medicine, and we do have master in research. So yes, this is very much based on your personal interest, right, Dr. Wong? So
Yes.
what do you think? Yeah.
Yeah, I think surely. I think I would always encourage people to go for postgraduate advancement studies if they wish to. Again, when they want to do it is really very much about are they prepared already to do it, and what is the intention when they do the masters? You know, is it too early for you to actually decide where you want to advance? But having said so, I think there are people who are very, very, very clear what they are going and heading already. Then obviously they could if they wish to. And again, depending what course you're signing up, you know, certain courses may expect that you have certain years of experience or, you know, things like that. Yeah. So that very depend on case-to-case basis. Yeah.
Okay. And yes, looking at the next question, right? It's asking about what are the fields that we can explore or involve for the pharmacy degree in IMU, whether it's in Malaysia or in overseas. So to restructure this question a little bit, I guess you are asking about what working area we can enter in Malaysia as well as in overseas. I will say that first of all, you must know where you want to work and which sector you want to work. And you should also know whether the country recognize the certificate, and does it require you to sit for any exam as well as any housemanship, isn't it? I'm sure in, for example, UK, Australia, New Zealand will be slightly different, right, Dr. Wong?
Yeah, yes. Yeah, that is very, very, very dependent on where you are, what type of position you are in, you know, at the end of the day. Yeah.
Yeah, it is very much depend on what position you want to venture into. So of course you need to check. But definitely the pharmacy degree will open up a door for you to explore various type activity opportunities. And if required, then you might just want to take 1 or 2 years additional to sit for certain exam to make yourself qualified to be practiced at the country itself. Okay.
Yes.
Right. We do have a last question. I think this is a general question. And after this, then we will close up the session. The question is actually asking about the difference between pharmacy as well as pharmaceutical chemistry. Okay. Just a bit of input from my side. I will say that for pharmacy, you will have the license. The main difference is you have the license to possess the drug. For example, if you want to open a pharmacy, you need a licensed pharmacist to be there so that you can store all the drugs, handle all the drugs. And of course, you expect yourself to have a patient contact. You need to deal with the patients, providing counselings and all that. For pharmaceutical chemistry, it will be slightly different. It's a 3-year program, and it is much more into manufacturing as well as R&D, quality control, slight overlap between pharmacists as well as pharmaceutical chemists. But the main difference is the pharmacist will have a high chance of a patient contact. Isn't it, Dr. Wong?
Yeah, yes. Pharmacy obviously is much more of a role where, I mean, again, of course, throughout the course itself, you will be studying a lot more about, they will be studying a portion where it's related to contact with patient. And the job that you do, perhaps 50 or maybe more % are actually relating to patient, you know, or customers, you know, if you work in a community pharmacy. But of course, pharmacy also allow you to do certain job that may not be directly with patient. Example, if you work in a pharmaceutical company relating to production, research and development, that type of job are mainly on the drug making, you know, drug formulating areas that may not require any patient interaction. But again, it requires you to have the licensing where it's equipped to tell that you are credible enough to be able to make your contribution as a pharmacist to manufacture, to advise, assure certain medication quality. Yeah.
Okay, thank you very much. So we actually answered all the questions, and we hope we clarify all your doubts. So if you require any further clarification, please, we welcome you to contact our admission office. All right, so I guess that will be all for the session tonight. Thank you very much for all your time. Thank you, Dr. Wong, for joining us today, and we hope to see you in IMU. Thank you, everyone.
Thank you. Thank you, everyone. Thank you.